Blepharoplasty, which can be either performed on the upper eyelids or the lower eyelids. And blepharoplasty literally means lifting of the eyelids or removing excess skin. For the upper eyelids, it's most suitable where there is a lot of skin hooding over the upper eyelashes. This can cause functional issues with keeping the eyelashes clean, and also problems with peripheral vision. So when somebody has so much excess skin, they can't sometimes see out of the corner of their eyes, and this can affect driving, concentration, and also working at computer screens. It's also common in patients who have inherited excess skin of the upper eyelids, and those patients definitely benefit significantly from having the skin reduced. So the procedure involves initially marking the lower sulcus of the eyelid, so where the eyelid, when it is open, comes back to in the eye socket, and that then marks the point of where I'm going to make the scar, and it's also the most hidden point for the scar. I then use a pinch technique which allows me to judge how much skin to take away, and this is done without any injection of the local anaesthetic, as I need to balance both the cosmetic outcome with the functional outcome, in that if I remove too much skin, then the eye does not close properly. And so that's why it has to be done before any local is injected, because the local swells the area up. And so I have to be able to judge how much skin to remove before injecting. Once that's done, I make that upper mark, and then I can make my injections, remove the skin, enter in behind the muscle, remove any excess fat that is in the eye socket and perhaps causing some bulging or fullness at the back of the eye, and then close the muscle layer and then the skin over the top to give a lovely refined upper eyelid show of approximately 8 to 10 millimeters of eyelid to be seen once the eyes are open. For the upper eyelids, can be performed most commonly under local anaesthetic. Very straightforwardly done. The injections are very comfortable to do, and we take things nice and slowly. People are generally a bit nervous about having a needle near or around the eye, but actually it's quite far away from the actual eyeball itself. And believe it or not, the skin in that area is not enormously sensitive, and so the injections can be initiated without too much discomfort or pain to the patient. This is a relatively quick procedure. It takes approximately 90 minutes, an hour and a half, and so patients should expect to be with us for at least 2 hours, getting ready for the procedure, having it, and then relaxing for half an hour following the procedure. We also provide a cool eye mask for the time after surgery in order to prevent any bruising and swelling in that area. The recovery is actually very quick. The eyelid skin is very thin and heals very, very quickly. So the incision should be healed in approximately 3 days. You need a wound check at 1 week to make sure it has completely healed and if there's any early problems. And then after 2 weeks, the scar should be getting very well settled, and by the 6-week mark, nobody should really know that you've had eyelid surgery other than that your eyelids are looking beautiful. This is a long-lasting procedure. I rarely have to repeat upper eyelid blepharoplasty, even in patients that have had it done 20 years prior. That's because there's not a huge amount of gravity on the upper eyelid skin, particularly. And once it's done, people should expect 20 years or more out of their eyelid surgery.